Hey, what's up, guys? So today is May 23rd, 2015, and as of today, I am a little bit over 5 months on T, but more importantly, I am 2 days post-op, which is super exciting. So this video is going to talk briefly about both things, since I didn't make a specific 5-month update, and I plan to, and then things just happen. But then I also want to talk a little bit about my experience so far with surgery. At some point, I do plan on talking more in depth about the things that I did to prepare for it and the things that I did to recover and all that, but I kind of want to get a little bit further down the road before I make some sort of video like that. So really what I'm just going to be talking about is my experience of the day of surgery and so far 2 days into recovery. But first I'm going to talk a little bit about my 5 months, woo, sorry, my hand is like out of the camera. 5 months on T, so that's exciting. But the changes I've noticed have been pretty small, but actually a little bit more drastic than the last couple months I've noticed. I think my voice is at very minimum leveled out, but I do think it's gotten slightly deeper since last month. My jaw has widened, to be sure. It's gotten a lot more square. And my Adam's apple is really coming in, which I'm sitting at a really odd angle, so you can't really see it. And it kind of looks like I have a double chin when I do this. But no, seriously though, I do have a much more prominent Adam's apple than I used to. And let me think. Oh yeah, muscle mass and strength. Both of those things. Those are the biggest changes I experienced this month. My muscles grew a lot and became a lot more defined this month. But I also was able to do a lot more physically, like strength-wise, than I've ever been able to in the past, which is really cool. To kind of put it in perspective, 2 months ago, in March, my PR for a back squat was 165, and then I did one, I think, about 3 weeks ago, just to max out again, and I got a 235. And so there's obviously a huge difference there. And that's kind of been pretty consistent along most exercises that I've been doing at CrossFit. So yeah, that's pretty much all I've got for 5 months. So I'm going to jump more into surgery now. I chose to have surgery with Dr. Medalie in Cleveland, Ohio. I just think he's one of the best surgeons in the country, and it also happened to be fairly conveniently located to me. There were a couple other ones I really liked. Dr. Raphael down in Texas, he had some really amazing results, but it's a little bit expensive, and it's definitely a little bit too far for me to feel like I want to travel. Dr. Fisher, and she's out east somewhere, I don't remember where, was also a little bit more pricey, and I wouldn't be able to drive home, so my cost for staying for the week or so after surgery would go up. And I really liked everything I'd been reading about Dr. Medalie, and his costs were a little bit lower, and so it honestly was just a perfect sweet spot for me. I live about 4 hours away from Cleveland, so it was definitely a doable drive up the day before, have surgery, stay the night, and drive home type thing. And that definitely sold me. So I know, and I'd briefly talked about this in another video about whether I was going to go for a DI or a peri. I kind of figured I'd be on the borderline, and Dr. Medalie had expressed that he thought I probably would be too, and so we wanted to wait until the day of surgery to look and decide at that point where to go. And so when I got there, we got there the night before, stayed there, and then went in at about noon on the day of surgery, which was the 21st. Filled out some paperwork, made my final payment to the Right Surgery Center. It was about $900. I'd already paid for my surgeon fees and anesthesiology fees prior to that, and so the total of it for all three things, all three components that added up to the total was $6,400, which is pretty reasonable actually. It's not like the cheapest, but I obviously wasn't. Top surgery is not something you want to go, hey, I got a really great deal on. So, you know, the $6,400 wasn't bad. I did pay it all out of pocket. I didn't try and do insurance with any of it. I just raised the money on my own, which was hard, but you know, it all paid off, and I was able to get the amount I needed successfully, so that was good. But anyway, so got there about noon, filled out the paperwork, kind of expected to be sitting there for a little bit longer, but they just called me back maybe 15-20 minutes after I was done with the initial check-in, took me back to the room, put on a gown, the surgical gown, and some slippers, and a really sexy hairnet, and then laid there, and they tried to stick me with an IV 4 times. That didn't work out, but they finally got one to take. It was fun. I have really weird veins, so they were having some trouble with that, but finally got the IV, and then Dr. Medalie came back and took a look at my chest and decided that I would be able to go with either, that I was pretty borderline, but I would be able to do Perry if I really wanted to. And I kind of asked him, I was like, well, what would be the possible downsides for that? And he said the contour of it might not be good, just because of the way that my body is shaped. I could have like a little lip of tissue that could like really skew the aesthetics of it. And then I was also really worried about nipple placement as well, and so just the fact that he wasn't 100% like confident that it would turn out awesome, I chose to go for a DI. I think Perry results are the best if you have the body for it, but I just didn't feel confident that I did. And so I thought I would rather deal with predictable scars than kind of throw my chest to chance, and either have it look awesome or it could look really bad. Because Perry results for people that shouldn't have had it, that were too big for it, it doesn't look right, in my personal opinion. And obviously, like, if you're happy with your body, that's totally fine, but for me, I don't want to have, I didn't really want to have to deal with really bad contour, and potentially like really messed up nipple placements. So I chose to go for a DI. And so far I don't regret that, but I also haven't seen my chest yet, so I guess we'll see how I feel about that next week. But I do feel better choosing something that's predictable than kind of taking that chance for me. So we decided to go with the DI, and he just marked up my chest, and then they brought my friends back, and I got to sit there and talk to them for a little bit, and they explained some more stuff about just the procedure and whatever, and signed a couple consent forms, and then gave me some, and I quote, happy medicine, which made me very happy. And they wheeled me back, and that's the last thing I remember until I woke up. And recovery was a little rough for me. I deal with a lot of nausea when it comes to extremely intense painkillers. I've had to take Vicodin and Percocet for like getting my wisdom teeth out, and I also had a really bad concussion, and so I had to take Vicodin for that. But both times I was throwing up, and it was not pretty. So I was really scared about having to take that medicine, and I haven't been completely under general anesthesia since I was like 4. Woke up and my pain level was like a 6 or a 7. Which isn't normal. Apparently it's supposed to be a lot lower than that because of the amount of local anesthetic that he puts into your chest. But I woke up and I was hurting pretty bad, so they gave me some, I don't know what it was, I didn't really care because it made it stop hurting. But then I was dealing with a lot of nausea for the first, I think, hour after I woke up. And they were really confused why, because they were giving me all these anti-nausea medicines and it wasn't working. But eventually something stuck, and at about the hour mark, I felt good enough to get in the car, and we went back to the hotel, and I pretty much just crashed for the rest of the night. So yeah, it was pretty seamless so far. Healing's been good. There's really not been anything that's caused me any concern. It's not comfortable, but I'm not in a large amount of pain. I would say the most pain I've been in since waking up has been about a 3 or a 4. Pretty consistently, it's just about a 1 as far as pain. Now, discomfort, it's not comfortable, especially because of the drains. The drains are by far the worst. They really hurt. It's like a burning, itchy, painful sensation right under your armpits. You can kind of see here. Let me tilt the camera down. They're hooked here. These are my drains, and they attach to a tube that comes up through my armpit, which is obviously not very comfortable. And so you have to empty those, I think, like 3 times a day or something. But yeah, the fluid isn't. I'm not losing as much fluid as I thought I'd be, which is good. And like I said, the pain is pretty minimal. So I've just been pretty much laying on the couch and sleeping and eating and trying not to take too many of the painkillers. I'm trying to rotate now as much ibuprofen in as possible, just to try and take the swelling down and also keep me off of narcotics as much as possible. So yeah, that's pretty much where I'm at right now. I've got this really awesome vest going on here, but that'll come off along with the drains on Tuesday. We're going to drive back up to Cleveland, and they're going to take my drains out, and I'll get to see my chest, and I'm sure I'll post another video of that here pretty soon. But for now, that's pretty much all I got, so take care, peace out, make wise choices.